Okay, hi everyone, good afternoon. My name is Lindsay Young. I'm an interventional radiologist at Columbia, and I'm going to be talking today about the AlphaVac device for PE thrombectomy, which we just had a little bit of a preview to, and the Apex AV trial. I have no disclosures. So I'm going to be talking about the new F18 or 18 French AlphaVac cannula, which is the newest cannula that has been designed specifically for PE, and the Apex trial, which is studying this cannula in PE specifically. So again, I apologize for all the redundancy. We did just have quite a bit of preview on this device, but essentially AlphaVac is a multi-purpose venous thrombectomy system that is designed by AngioDynamics. You can see kind of what we just saw on the screen in the live case, the fully assembled device on the bottom right here. Of note, which we also were just discussing, AlphaVac does not require cardiopulmonary bypass, not to be confused with AngioVac, which is a separate thrombectomy device that's also manufactured by AngioDynamics and named similarly. It comes in a variety of catheter sizes and shapes. So the catheter that they just used for the SVC case is the middle catheter you can see here. That's the 22 French catheter with a 20-degree angulation. The other 22 French catheter has a 180-degree tip, which is commonly used in cardiac thrombectomy, for example. These larger bore catheters are typically used for larger venous thrombectomy, IVC, iliacs, atrial, clot in transit, for example. And then the newest catheter, which you can see on the far right, is the 18 French catheter, which was designed specifically for use in PE, which I'm going to be talking a little bit more about today. So this catheter, again, is smaller. It goes through a 22 French sheath. The catheter that they were using is the 22 French catheter, which goes through a 26 French sheath. So this one goes through a 22 French sheath. It's a little bit longer in length. It's 105 cm to be used from the groin into the PAs, and has an 85-degree angled tip, which is essentially meant to be able to navigate around into pulmonary arterial branches and between the right and left PA. It is currently FDA indicated for use in venous thrombectomy just based on prior approval of those larger catheters, and has an investigational device exemption for use in PE through the Apex trial. So this is the device in a little bit more detail. I know they touch on some of this stuff, but essentially I'm going to just touch on some of the basics of the setup of the case. So again, this sheath is not meant to be used alone. It's meant to be used through a larger sheath. For a PE case, you could use a 26, but you could use like a 24 French dry seal in the groin would be appropriate. You want something maybe a little bit larger to be able to pull back if there is large thrombus corked on the catheter, to pull back through the sheath. So maybe start with like a 24 French dry seal in the groin. You would gain access into the pulmonary arteries and then advance the AlphaVac sheath with the dilator up into the PA. And then when you're ready to insert the cannula, you would remove the wire and the dilator and just advance the cannula through the sheath. And then once you're in the PA, you would unsheath the cannula with the funnel tip. So you can see the F18 cannula at the bottom. There is the funnel tip, which on the 18 French catheter has an outer diameter of 33 French, which is quite large. There's a handle alignment rib on the back of the catheter, so this allows you more torqueability to be able to navigate it around in the pulmonary arteries and gives you an orientation of where the curvature of the catheter is. There's a quarter turn locking valve on the sheath, which essentially allows you to lock that orientation of the cannula within the sheath if you don't want it to be able to move around. The volume limiter switch has that switch between 10 and 30 cc actuations. They kind of term the 10 cc actuation like a clot hunter mode. So you do get some tactile feedback when you're engaged in something, especially large. So you can essentially take smaller actuations to limit blood loss. And then when you feel engaged with something, you can turn on the 30 cc and take stronger repeated pulls to actually clear it through the catheter. There's also a vacuum lock mechanism. So once you've built up some pressure, if there is, for example, something occluding the catheter or corked on the tip of the catheter, you can lock it if you do need to take the catheter out. And then there's also an accessory TUI port. So on the handle and also on the cannula itself, there's not a lure lock or some other sort of injectable port to be able to do runs directly through the cannula or to take pressures. But you can insert up to an 8 French diagnostic catheter through the TUI port and actually use that to take measurements and do runs if you want to. So these device features were designed with specific goals for treatment of PE in mind. Again, the funnel tip is, the goal is essentially to improve efficiency of thrombectomy and limit corking of thrombus as compared to a standard tip 18 French catheter. Like Dr. Sheila was explaining, you can kind of repeatedly pull the handle to increase the amount of suction that you're getting, which is somewhat unique, and that can also potentially help increase the efficiency of thrombectomy. The tip of the catheter with the funnel actually is very soft. It's meant to be navigated freely between the PA branches and from the right to the left. So this can increase the speed of the procedure instead of having to exchange the catheter or move the catheter over a wire, or potentially exchange it out and then navigate between the right and left sides, for example. And then also that volume limiter switch allows you to adjust the blood loss during the procedure and actually adjust your suction power, so you have some control over that when you're engaged versus not engaged. So AngioDynamics, in collaboration with the PERC Consortium, is conducting the APEX AV trial, which is a multi-center single-arm study of up to 120 patients at 30 centers across the US, evaluating the safety and effectiveness of mechanical aspiration thrombectomy using the AlphaVac F18 device in a prospective trial of patients with acute intermediate risk PE. The first patient was enrolled about 1 year ago. They're including patients with signs and symptoms of acute intermediate risk PE for 14 or less days with an RV-LV ratio of greater than 0.9 and systolic blood pressure greater than 90, heart rate less than 130. So there's no high risk or massive PE patients included in this trial. Some notable exclusions include, but are not limited to, pulmonary arterial pressures greater than 70, significant oxygen requirement, pressor requirement, recent thrombolytics within 30 days, or contraindication to anticoagulation. There's an initial assessment and then also follow-up assessments at 48 hours discharge and 30 days post-procedure, looking at CTA, RV-LV ratio, FiO2, some various lab components, and then also adverse events. The primary endpoints for efficacy are reduction in RV-LV ratio from baseline to 48 hours post-procedure, and the primary safety endpoint is rate of major adverse events. So I wanted to show just a quick case. So this is a case that was performed actually by Dr. Mona Ranade at UCLA. She's one of the national PIs on the APEX trial. This was a patient who presented with intermediate risk PE. You can see on the CTA images there's bilateral thrombus with a larger clot burden on the right side. And then you can see the device in situ on the left. So the sheath is up in the main PA and the cannula is advanced into the right PA. And they're actually using a diagnostic catheter through that TUI port to do an injection where you can see filling defects which correspond with the thrombus that we see on the CTA. These are the post images. You can see a relatively significant reduction in clot burden. This case took just short of 1 hour. They used 4 10cc pulls in that sort of clot hunter mode, and then 6 30cc pulls to get the volume of thrombus that you see on the right side. And there was a slight reduction in main PA pressures at the end of the case. So in general, given these unique features, that we've been discussing about AlphaVac, I think it's very, very promising to potentially have a lot of use in PE. You are still crossing the heart with a 22 French sheath, so it's not extremely small, but I think that it will be exciting to see the results of the APEX trial, and if they meet their endpoints, it's certainly an important trial contributing to a growing body of clinical evidence needed for the treatment of QPA and PE in this space. 87 patients have currently been enrolled, and they're actually looking to complete enrollment by early next year. So, thank you.